Okay, well, thank you everybody for joining us this Monday morning. My name is Lori Smith. I am the training coordinator with Direction Home Area Agency on Aging and Disabilities. I'm going to quickly run through some housekeeping notes before we get started. And then if you'll indulge me for just a few moments, I'd like to share with you a little bit more about what Direction Home is and what an area agency on aging does, and how maybe we can help you or a loved one aside from these Medicare seminars that we love so much every year. So first of all, housekeeping, if we could please stay muted throughout these presentations, and that just keeps background noises and distractions down to a minimum, that would be great. We will be collecting your questions in the chat window, so please make sure you've got that open as well from your computer or laptop. If you're not familiar with that option, you should see a strip of menu items either at the top or bottom of your screen, and you may have to move your mouse around to get it to pop up. But you'll see something that says chat. It looks like a little thought bubble, so just go ahead and pop that open. Feel free to turn on your camera and share your beautiful face with us. Not mandatory, but you know, I still miss people, so it'd be great to see you. But again, if you choose to do that, just be mindful of what might be going on behind you, or any movement you might be doing can also maybe be a little distracting to our other participants here. So if you need to get up and stretch or whatnot, go ahead and turn that camera off. And when you're ready to rejoin, go ahead and turn that camera back on. You should all by now have received your packets in the mail of our supplemental materials if you requested it. And we'll be going through those items in there. I will encourage you during my piece of this presentation, go ahead and grab that agency brochure. We'll be talking about some of the programs in there. Again, we will be collecting questions in our chat, and we'll ask those after everybody is done speaking. So again, I'm going to do a quick run through of Direction Home and the services we can offer. Francine will be up next with our Medicare information. Thank you, Courtney. And then we also have the pleasure of having Robert Fenn with us from Social Security Administration, and he'll share some information too. So I'll go ahead and kick it off here if you'll indulge me for just a little bit. Let's see here. So quickly, who we are, you can see on the screen both our mission and vision. Kind of wordy, we know, but what it ultimately means is we at Direction Home provide choices for people to live independently in the place that they want to call home. And we have so many ways that we can go about doing just that. Who we are a national network of area agencies on aging. You can see there's 655 area agencies on aging in the nation. So again, if you happen to move about, or if you have a family or a loved one who might need some of the services that we can provide, know there is an area agency near you anywhere. And if you need contact for information for any region, let me know. I can get that to you. We are one of 12 area agencies on aging in Ohio, and our service area is Portage, Stark, Summit, and Wayne counties. And there you can see kind of our business makeup, our board members, executives, and then our staff, of which that's actually a low number. We're almost up to 250 staff. Mostly you can see there's social workers and registered nurses. There's a snapshot of Ohio and where we are in that northeast part. And you can see we team up pretty closely with the 10A just to our north that serves the Cleveland and surrounding areas, and 11 to our east who takes care of the Youngstown area, as well as 9 to our south. But here again, if you have a need in any other area in Ohio, let me know and I can get you contact information for that area agency that takes care of those regions. Quickly, what we do, and again, these are just the broad strokes. You can see we have these core services that we provide, and I'll start down in the bottom left with our Aging and Disability Resource Center, because that is generally the first point of contact with any area agency on aging. Every single one in the nation has an Aging and Disability Resource Center, and they are for information, any question you might have, in a referral service. And moving up and to the right, we have our Elder Rights Department, who houses our Long-Term Care Ombudsman Department. And I'll touch on some of these as we go around. We do have health and wellness programs that are free for our community members to attend. Things like falls prevention workshops. We have Tai Chi Chuan that is great for improving strength, balance, and flexibility. We just started something called Bingo Size that combines bingo with learning about falls prevention, healthy nutrition, staying active, both physically and cognitively. So that's a really fun program to lead. And then we have powerful tools for caregivers, which really focuses on those unpaid family caregivers. Letting them know that we know what you do is out of love, of course, but we also understand there is some stress that comes with it, and how to take care of you and resources that are available just for those family caregivers. Our home and community-based services is where our care managers are housed, by far our largest department. We do have nutrition services that can connect you with those farmers market coupons or home delivered meals. And then finally, again, that caregiver support that really focuses on our family caregivers. So some of the programs that we offer, and here again, if you look in that the brochure that is included in your packet, you will see these programs and more. If you flip it open to the first couple of pages, it's got a beautiful chart in there of the services and supports that we provide, how you qualify and who qualifies. But please, as you're looking through that chart, do not discount yourself. If you have any questions about any of those programs, give our Aging and Disability Resource Center a call. They will talk through with your initial and your individual situation, and they might see a way to fit into one of our programs that, we can't fit into that tiny little brochure. So please give them a call. I think most people are familiar with Passport. It is a Medicaid waiver program, and you can see there on the slides the services that it can get someone are personal care aides, adult day services, emergency response systems, so those pendants that I've fallen and I can't get up, home delivered meals, things like Mom's Meals or Meals on Wheels, transportation services to and from your doctors or other places as well. Minor home modifications. So if you need a doorway widened to now allow a wheelchair through, or a walk-in shower, or you need your roof fixed, we can help get that done. Chore services, and then specialty consults. And that's, again, just an abbreviated list. We have so many more things that can offer. And it is for folks 65 and older who, again, are eligible for Medicaid, that should say Medicaid, that need physical help for everyday activities. Assisted living waiver. It provides individualized care and assistance with housing, personal care, and healthcare services in an assisted living environment. That's for folks age 21 and over eligible for Medicaid. And that's really the start of why we added the and disabilities onto our name. It's not just for our older population. We do ask that you would be able to pay a monthly room and board payment, and the level of care means you would require hands-on assistance with at least 2 daily personal care activities, things like dressing, bathing, toileting, something like that. The last one I am going to touch on is MyCare Ohio. It coordinates physical, behavioral, and long-term care services. It's available for people 18 and over who are eligible for both Medicaid and Medicare. And along with that, you are entitled to a MyCare Ohio ombudsman who would advocate for your individual needs and also assess what's going on with MyCare Ohio themselves. And anything that may be not up to par, they will go ahead and investigate that and help it be resolved. So let's touch first on our Aging and Disability Resource Center. Again, I mentioned that is generally the first point of contact when somebody connects with a area agency on aging. It is the front door to long-term services and supports, and our trained representatives have an insane amount of knowledge of our local community resources available, and we help people applying for programs and benefits to help you remain in your community through the 3 units that the ADRC is comprised of: screening, assessment, and pre-admission reviews. They can also make level of care determinations to authorize Medicaid to pay for nursing facility stays. So down below, you can see kind of the steps that would take. Someone would call us looking for help, and then that representative would gather an initial screening information, and then we can go ahead and schedule a free in-home assessment with one of our registered nurses to go ahead and do a deeper assessment and look at your eligibility for our programs or other care options. A quick look at how many people we were able to connect with in 2021. So over the phone, we were able to get people resources, just over 22,000 people. And again, this is 2021. So this is right in the middle of pandemic. We were still very socially isolated. We did all of that over the phone. We were able to do almost 6,000 one-on-one in-person assessments. And again, that was as able. And just over 5,500 people were assessed for initial or continued enrollment in MyCare Ohio Medicare and Medicaid waiver programs. And you can also see here our most requested services that we have are transportation, those home delivered meal services, utility assistance, and chore and homemaker services, as well as those emergency response systems. Our home and community-based services, again, this is far and away our largest department that we have, and our care managers provide customized care management, keeping people healthy, happy, and thriving in their own homes. Here again, in a single year, we completed 25,000 home visits and made 50,000 phone calls just to ensure people's well-beings, which resulted in over 7,500 frail individuals successfully living at home with, this is a really important part, an improved quality of life. Some examples of services that our care managers can connect you with and maintain for you. Again, the adult day services, counseling services are available. If you need durable medical equipment, something like a cane, a walker, even a hospital bed, something like that, we can get that for you. Those home delivered meals, medical and non-medical transportation. There are respite services available, and we also do work with a lot of senior volunteers. Provider relations, Tim, I'm looking at you. He is recently retired from this department. They are really our quality assurance department in here. So we contract with so many providers, and we want to make sure that those providers are getting you the top quality care that you deserve. So our provider relations department makes sure that happens. We monitor those providers, again, to ensure compliance and encourage the highest level of care. Our provider network provides services to almost 8,000 older adults and individuals with disabilities. And here again, in 2020, right in the middle of the pandemic, we connected 128 people with entry into our wellness programs. So those health and wellness programs that I talked about earlier, the falls prevention, the bingo size, and the powerful tools for caregivers. We got out over 600,000 home delivered meals, over 150,000 congregate meals, just over 5,000 transportation trips were given to folks, and minor home repairs, those doorway widenings, showers, roofs, water heaters, whatnot. We spent almost $500,000 in getting those modifications made for folks that needed them. Again, these are a snapshot of the providers, the services that they offer that we monitor and connect with. Again, assisted living waivers, caregiver respite, community transitions, emergency response systems, and the list is exhaustive. We manage over 300 providers. And again, you can see there how many passport, assisted living, Older Americans Act, and care coordination providers that break down there. Our Elder Rights Department, it is our residents' right department, and they truly, truly uphold residents' rights to dignity, respect, and quality of care in long-term care settings. Who we serve, we, of course, have our 4-county service area of Portage, Stark, Summit, and Wayne, but we also work with those counties directly below us of Belmont, Carroll, Coshocton, Guernsey, Harrison, Holmes, Jefferson, Muskingum, and Tuscarawas. And that brings us up to overseeing over 160 nursing facilities, more than 140 adult care homes, and over 120 assisted living facilities for a total of 428 licensed and certified facilities in that 9-county region. Again, in a single year, our Ombudsman Department opened more than 1,500 cases, and we investigated over 2,000 individual complaints. Our staff spent over 6,000 hours investigating complaints and concerns that people had with their long-term care facilities. And then we also really rely on our volunteers in that department, and they spend over 1,300 hours of service helping our ombudsman out, going into facilities and really talking with the residents. We do have 37 of those volunteers, and almost 3,000 hours were spent on just advocating for those residents. Our operations department is the behind the scenes folks, communication, human resources, IT. And the very first seminar that we did, I had somebody from our finance department run up to me afterwards and he said, "Hey, that's great, where are we?" So I'm mentioning them here, our finance department, very important, they keep us running. Our communications department is in charge of education, and we do things like these, our Medicare seminars. We also have a speakers bureau where we are more than happy to come out to your organization and talk about what we do, how we can help, and all things healthy aging. And we do offer continuing education for our licensed professionals to help them maintain their licensure. And over 21 years, we have more than doubled our staff. We also have an online presence, and by next year, I would love to see these numbers go up. So if you are not connected with us on Facebook, Twitter, LinkedIn, or visit our website, please do. And there again, internally, you can see the powerhouse that our IT staff is and how they help us out. We do have a foundation, and we have a huge need, especially in our particular service area, to get these services out to people who don't qualify for Medicaid, but they yet don't have in-pocket funds to be able to pay for those services that would allow them to stay there and thrive in the community. There really is no funding available for that gap population. So this is what our foundation does. Our mission with that is to enable older adults not eligible for Medicaid government assistance to remain independent and secure at home through access to a range of supportive services. And then our vision is all those older adults in our region should have access to community-based long-term care, regardless of their ability to pay. We do have 2 fundraisers that we do each year. The first and the largest is our annual raffle, which we just wrapped up. And 100% of those proceeds goes towards advocating for that gap population. We need to talk to our legislators and tell them how important it is to get funding in place to help those folks that, again, can't get services and have Medicaid pay for it. They don't qualify for Medicaid, but yet they don't have enough in pocket to be able to get them on their own. Every year, we raise over $170,000 just through our raffle. This year, it was $178,700, if I'm recalling correctly. And then since 2000, we've raised over $2 million. And again, 100% of those proceeds goes towards that advocacy. And then our Care for a Lifetime campaign is completely internal, completely staff driven. We raise over $60,000 annually just in employee donations. And those are the dollars that go directly toward helping those folks out, getting them those services. And currently we serve 339 people through that care coordination program. And that's the program that helps that gap population. 16 older adults with moderate income are placed in the care coordination program each and every year using these funds that are raised through our Care for a Lifetime campaign. Just quickly, I'd like to share with you the kind of people that we are able to help. And you can see that it's people like you and me in any situation as possible. So first, let's look at Eloise. Eloise is 68 years old and she lives all by herself in her 2-story home. Her daughter does bring her groceries once a week, and she has signed control of her finances over to her daughter. She just doesn't feel confident that she can really take that on anymore. She has said that she wants help getting more food in and a little help with preparing her meals and getting dressed and bathing herself. Her daughter does go to all her doctor appointments with her, but she doesn't really share any suggestions or offer help for her mom. So what we can do as an area agency on aging is if the doctor chooses to make a referral to us, our aging and disability resource representative would connect with Eloise and do that initial assessment with her. And then after that, she could schedule that deeper in-home assessment with one of our registered nurses, and that nurse would assess her for passport eligibility. The nurse assessor would help her then complete a Medicaid application and send that request in for additional waiver services. And then, of course, we would track the status of that application as it moves along. And if we find she is eligible, we'll go ahead and enroll her into the passport program. And what that can get her is 1 to 3 days with a personal care aide to help her with that bathing, grooming, dressing, and her errands. We can get her started with home delivered meals 10 times a week, and that will help her with her additional nutritional needs, transportation to and from doctor's appointments, and get her that emergency response pendant for her. And if we notice signs of financial exploitation, we hope there's not, but we will kind of keep an eye open for that. And if we notice that something is going on, we will absolutely make a referral to Adult Protective Services. And that happens whether or not she's enrolled with our passport service or not. And then our social worker can also get counseling started for her, as there might be some additional counseling needs touched on during that first assessment. William, our next gentleman down, is 72 years old, living alone in his 2-story home. He has hypertension, diabetes, and GERD, and he's really feeling isolated and quite lonely. He has limited income and absolutely no savings, and he does not have any close relatives or children who live near him who could help him out. He's starting to think about maybe going to an assisted living community. So what would happen here is, again, that doctor would make the referral to our Aging and Disability Resource Center, and that representative would, again, do that initial screening with him for assisted living placement and would go ahead and schedule that in-home assessment with our nurse. And they would come out, the assessor would help again with that Medicaid application, and then share a list of assisted living waiver providers and send in a request for assisted living waiver services. And there again, we track those applications and follow them through to the end. And if we find that we'll track that eligibility status as it moves along. And while he is still living in his home, waiting to see if he's approved for assisted living waiver services, we can also assess him for passport services. So if eligible for passport while he's still at home, we can get grab bars installed for him, that emergency response system, home delivered meals, transportation to and from doctor's appointments, and transportation to those assisted living facilities so he can physically see them to see if they're a good fit for him. If we find he is not eligible for passport or assisted living waiver, we will continue to connect him with community options for home delivered meals, friendly visitors, referrals to the Ohio Senior Health Insurance Information Program for any financial concerns, and place him on our wait list for that care coordination program, again, for those who don't qualify for Medicaid, can't pay out of pocket, and encourage him to make an appointment with a private pay assisted living because some of them do have lower costs if it is a semi-private room. And I want to go back to where we continue to work with him if he's not eligible. That's across the board for anybody. If we find that we just can't get you on one of our programs, we don't dust our hands off and say, well, it's been lovely chat, best of luck to you. We do work with you still and get you connected with other community resources so you can get your needs met. And then finally, Fiona, she's 85 years old and lives alone in a senior apartment building. She has COPD with shortness of breath, and it does get worse if the weather is too hot or too cold, and she uses oxygen 24/7. She also has poorly controlled anxiety that increases when she leaves her home, and that also exacerbates her COPD and her shortness of breath. Her daughter helps her, but is understandably anxious about her mother's condition. And after a checkup with her doctor, leaving the house raised her anxiety, made her short of breath, and that the doctor then sent her to the emergency room. While she was in the emergency room, she was admitted and she contracted C. diff while there. She had a 4-day stay in the hospital. And after she was all cleared up with her shortness of breath and the C. diff, the hospital discharged her to a nursing facility for continued rehab. After a very short stay in the nursing facility decided that they wanted to discharge her because they feel that she no longer needs the skilled care that she was receiving. However, the daughter absolutely feels that she is not ready to come home and care for herself. So what can happen here is, again, the doctor would refer Fiona or her daughter to connect with our long-term care ombudsman department. And then an ombudsman would visit Fiona in the nursing facility and talk further about her options for discharge, what we can do to make sure she is safe and comfortable when she leaves that facility, maybe connect her with a home care aide, or suggesting she might apply for institutional Medicaid. And what that could do is Medicaid could then be parlayed into home care or a further home assessment. So there again, you can see that there are so many situations. And again, these are just 3 that we can help so many people. I also wanted to quickly go over, for those of you who opted to get those materials online, or anybody who got them through the mail but still need further information, or maybe some more packets, or want to share it with somebody else, this is where you can find it online. So this is our website. When you go to www.dhad.org, this is the home page here. And when you go to that 3rd blue block that says resources and education, that drop down menu will automatically pop up. The 4th option down is Medicare education. Go ahead and click that. And this is what you'll find when you'll get to that page. You'll see a little video about who we are and what we do. Grab a box of tissues, have that handy if you decide to watch that. But then as you scroll down the page, you'll see the schedule of our upcoming Medicare seminars, and just below that, you'll see not able to attend, but would still like the materials. And then below that are all clickable links to get you the materials that are included in your packet. We are recording this session and it will be posted on our website. So anything here, if you want to refresh it, or again, get it to somebody who isn't able to attend, you'll be able to click that and watch it. Our Advantage Plan comparison charts, Part D comparison charts, and all of those materials are available there for you. Here's our contact information, also included in that brochure for Direction Home. Calling that 877 number or emailing that screening@dhad.org will take you directly to the screening department, that Aging and Disability Resource Center. And we also do have an online referral system. So I will now happily turn it over to the person you actually came here to see, Francine. I thank you for your time and attention. I greatly appreciate you, but go ahead, Francine.
Thank you, Lori. Good morning, everyone. So you're all here to talk about Medicare, and that's what we're going to do. I will start with talking about Medicare enrollment. So if you have not enrolled in Medicare yet, if you enroll in the first 3 months prior to age 65, your coverage will start on the month you turn 65. If you happen to turn 65 on the first day of the month and you enroll in those first 3 months prior to your birthday, coverage will begin the month prior to your 65th birthday. However, if you enroll the month you turn 65 or during the 3 months after you turn 65, coverage doesn't start until the month after in 2023. So the best time to enroll in Medicare is 3 months before your 65th birthday. Enrollment into Medicare is automatic if you are currently receiving a Social Security check, because the Social Security Administration knows who you are and knows how old you are, or if you are receiving railroad retirement benefits. Enrollment in Medicare is also automatic if an individual is under the age 65 and has been disabled under Social Security rules for 24 months. There are some special enrollment periods. So people who are impacted by emergencies or disasters, or have been previously incarcerated, or if there's an error in their health plan or employer enrollment, or exceptional cases beyond that, such as a person who may have been hospitalized for a long period of time and missed the actual enrollment period. But you would have to prove any of these special enrollment, any of these reasons for a special enrollment. If you are already on Medicare, The reason we do these seminars now is it is open enrollment time. It began in September on September 15th. It will end on December 7th. And this is the time when you can make changes to your Medicare. If you have been in a Medicare Advantage plan, such as SumaCare or Anthem Senior Advantage, one of those, you should have received what's called an annual notice of change in September that told you how your plan will change. It is important for all beneficiaries at this time to look at their current coverage and compare it to other options. And this includes all Medicare beneficiaries, which would include people who have both Medicare and Medicaid. People always tell me they find Medicare confusing, but actually, if you think about it, there are only two kinds of Medicare coverage that you can choose from. One is to choose a Medicare Advantage plan. The other is to be on traditional Medicare. With Medicare Advantage plans, you have to have Part B, so you've got to have Part A and B. They are not supplemental plans. Many people like to call these plans supplemental. They're not supplemental, they're just another form of Medicare. Supplemental plans are something different that we will discuss a little later on in the presentation. Most Medicare Advantage plans include drug coverage. So they kind of wrap in your Part A, your Part B, and your Part D. They have to cover the same services as traditional Medicare, but they also cover extra benefits. There are out-of-pocket limits in these plans, which is good for people with high medical costs, but there are geographic restrictions. You have to choose plans that are available within your county, so within the county in which you reside. Also, there are provider restrictions and prior authorizations often required when joining these plans. In traditional Medicare, there are no extra benefits. So you don't get a gym membership, you don't get vision, you don't get dental. There are no out-of-pocket limits. There are co-pays, which we will discuss for 2023, but to cover your out-of-pocket costs, you can purchase a Medicare supplemental policy, sometimes known as Medigap. With traditional Medicare, unless you have creditable coverage through a retirement plan, you must add, or through the VA, you must add a standalone Part D plan. But there are no geographic restrictions. You can go to any provider in the United States who takes Medicare, and there's no gatekeeper or no need for prior authorizations before you receive a service. I'm going to start out talking about Medicare Part A. Medicare Part A is often known as your hospital coverage, but it also covers blood, home health services, hospice care, inpatient hospital care, and skilled nursing care. With hospital insurance in 2023, first of all, for Part A, there's no premium for most of us because we've already paid into Medicare. So if you or your spouse worked full-time for 10 years, you will not have a premium for your Part A. If you enter the hospital in 2023, you will have to pay a deductible for the 60-day benefit period. And that deductible will be $1,600 in 2023. So if you happen to be hospitalized after day 60, which is extremely rare, we all know that hospitals like to send us home after 3 or 4 days, but Medicare would cover you days 61 through 90, but you would have a daily coinsurance of $400. You can, if there is a crisis, a healthcare crisis, and you remain in the hospital longer than 90 days, you can use your lifetime reserve days. And that would cover you for days 91 through 150, but there is an out-of-pocket cost of $800 per day. Medicare Part A also covers skilled care in a nursing home. Skilled care is not custodial care. Custodial care means when a person needs help with their activities of daily living, such as bathing, grooming, eating, Medicare does not cover nursing home stays for those types of services. Medicare only covers skilled care, and skilled care means physical therapy, occupational therapy, or speech therapy, or if a person is so medically complex, they need the assistance of an RN on a daily basis. Under traditional Medicare, there has typically been a need to have a 3-day hospital stay before traditional Medicare will cover you. This is not the case during the public health emergency. And the public health emergency has now been extended till about the middle of April. When the 3-day, or if the 3-day hospital stay goes back into effect, people need to know that observation status does not count towards that 3-day hospital stay, and neither does the day of discharge. So once a person enters the nursing home for rehab or other skilled care, they will have full coverage with no out-of-pocket costs for 20 days. After day 20, the out-of-pocket cost or daily rate would be $200 per day in 2023. Now, the skilled benefit under Medicare can last for up to 100 days, but people need to understand that it's very difficult to stay skilled for 100 days. And typically, people will stay skilled for maybe 3 weeks, and then Medicare will cease. But there is that 100-day benefit if needed. A new benefit can begin if an individual does not receive skilled care in a hospital or nursing home for 60 days in a row. However, this too has been waived during COVID. Part A hospice coverage includes comfort care, not curative care, services for pain relief, coverage of medications and durable medical equipment, aid and homemaker services, spiritual and grief counseling, but it does not cover room and board in a nursing home, except if an individual has a respite stay. And this is a short-term stay. Typically, when a person is receiving hospice services at home and the caregivers or family needs a break, needs to go on vacation, they can get hospice care in a skilled facility, but there will be a 5% copay for this service. So we just finished talking about original Medicare Part A. Now we're going to talk about Medicare Part B, which is your medical insurance. So Medicare Part B covers things like durable medical equipment, doctor's appointments. There is a premium for Medicare Part B. And the good news is that premium is going down in 2023. So this year we saw that premium go up to $170.10 a month. That premium will go down next year to $164.90. Part of the reason for this is that last year there was a medication that was approved for Alzheimer's disease called Adalimumab. And the cost for that medication was extremely high. So Medicare thought that a lot of people would be taking this medication that would be covered under Part B, so they increased the premium. However, the cost of this drug has been reduced, and it is now only used in very limited circumstances. So in addition to a premium for Part B, there is also a yearly deductible that you would pay in the beginning of the year, which will also go down in 2023 from $233 this year to $226 next year. There are out-of-pocket costs for covered Part B services, and those costs are 20% of the Medicare approved amount. This is usually waived for preventive services. So you typically do not pay anything for preventive services that are covered under Part B, but realize that 20% of the Medicare approved amount may not be the total cost of the bill that you see. So let's say your doctor charges $100 for a visit. Medicare pays the doctor $60. You would only pay 20% of $60. And the remainder of that bill would go away in Ohio because we have a no balance billing law. So make sure you look at your statements carefully. Also, please recognize that Part B is income adjusted. So if you have a higher yearly income, you will pay more for your Part B. Some people can actually delay enrollment in Part B. So if you or your spouse has medical insurance with a current employer, you can delay your enrollment in Part B, but you have to inform the Social Security Administration. Also, please be aware, if you have insurance through an employer and you lose your job and you decide to take COBRA insurance, your COBRA insurance might last for 12 months, but if you're Medicare eligible, you still have to enroll in Part B within 8 months. And if you do not, you will pay a penalty. So there is a penalty for not enrolling in Part B when you first become eligible. That penalty is 10% of the yearly premiums, or is 10% of the premium for each 12 months you were eligible and did not enroll. So please, please, please make sure you enroll in Part B on time so you can avoid that lifetime penalty. So you see, there are out-of-pocket costs with traditional Medicare. This is why some people elect to buy supplemental plans, also known as Medigap. Now, if you received your packet of information before today, you received a chart that looks like this. Hope you can kind of see that. And at the top, it says Medigap Policies 2023. These policies are standard private insurance. They only go with original Medicare. So you have to have Part A and B. You need to recognize that the premiums will vary by the company that sells these plans. So Part A in Ohio is the same as Part A in California, but many companies sell these plans. They can be sold by AARP, they can be sold by Aetna, they can be sold by Anthem. But for the same coverage, you might pay a different premium, just like you would for car insurance. Also, plans C and F are only available now to those who were eligible for Medicare and enrolled in at least Part A before January 1st, 2020. And those individuals who already had those plans are grandfathered in. But anybody else new to Medicare after 1/1/2020 cannot roll in those two plans. Also, these plans do not cover prescriptions, dental, vision, or long-term care. So there aren't any extra benefits. There are two of these plans. You see plans K and L that do have some out-of-pocket limits. There is also some foreign travel coverage with some of these plans. The best time to buy them is the first 6 months you enroll in Medicare. And the reason for that is during those 6 months, insurance companies cannot ask you about your health, cannot ask you about any pre-existing conditions. And so they must cover you if you wish to enroll. If you try to enroll in a Medigap or supplemental plan after that, they can ask you about your health and they can underwrite you based on any pre-existing conditions. So you could end up paying more for the premiums. Also with these plans, the premiums can increase with age. So be aware. There are what we call Medicare savings programs. These are the numbers for Ohio for 2022 and into part of the year for 2023. And these are for people with limited incomes and limited resources. So you can see that there are 3 programs. QMB, Qualified Medicare Beneficiary, will pay for a person's Part B premium and all deductibles and copays. And I also believe they can get, if they get their copays paid under Part A. There's also the Specified Low Income Medicare Beneficiary and QI program. The income limits and resource limits are a little higher for those. And to be eligible for those, you can enroll, you can contact your local County Department of Job and Family Services, or you can call Direction Home and we can help you apply for those programs. So we covered Part A, we covered Part B. Now we're going to cover Part D as in drugs. So every year there's what we call a standard benefit for prescription drug insurance under Medicare, and it changes yearly. In 2023, plans that offer prescription drug coverage can have an initial deductible up to $505 per year. There is also the initial coverage limit. So once you and your insurance company pay for your medications and that amount adds up to $4,660, you will fall into what we call the coverage gap. It's not called the donut hole anymore because coverage is much better at this time than it used to be. In the coverage gap, you would receive a 75% discount on most of your medications. Then, if your costs continue to rise and you pay out of pocket, so this is only what you pay personally, and that amount reaches $7,400, you would fall into the catastrophic coverage period. And at that point, you would only pay 5% of the total cost of your drugs, or $4.15 for generics and $10.35 for brand names. For Part D, again, there are two choices. If you have traditional Medicare and you don't have creditable coverage from a retirement plan or under the VA, you would have to select what we call a standalone prescription drug plan. And in your packet, you also have a chart showing these plans. This chart has the green band at the top. With these plans, you will notice that there is an annual drug deductible in most of these plans of that $505. So plans can't charge more than that for the deductible. They can charge less than that, but that is the limit. Most of those do have that. There are a few who do not. The chart also shows you which plans have additional drug coverage in the gap, and it will show you the star rating for those plans. And with star ratings, I always recommend that you never choose a plan with less than a 3.0 star rating. Star ratings, the highest star rating is 5. So if you choose traditional Medicare, you have to choose a standalone drug plan, as I said, unless you have coverage through the VA or other creditable coverage. Medicare Advantage plans, most of those include drug coverage, although there are a few who do not. Again, if you do not select drug coverage when you first become eligible, you will have a lifetime penalty that will be equivalent to 1% of the average national premium for each month you did not enroll. And you cannot enroll in drug coverage mid-year. So here's what I say to people who ask me or who say to me, I don't take any medications. Why should I join a plan? Well, if you become ill in the middle of the year, you can't get prescription drug coverage through Medicare. You would have to wait till open enrollment, and your coverage wouldn't begin until January of the next year. So look at it this way. You don't wait till your house burns down to get homeowners insurance, and you don't wait till you're in a car accident to get car insurance. So please try to enroll when you first become eligible so you can avoid those lifetime penalties. There are special enrollment periods for Part D also. If you move out of your service area, so if you move out of the county, you can change plans. Or if you move out of the state, if you move in and out of a nursing home, if you become eligible for both Medicare and Medicaid, you can change your plan. And then again, other special circumstances that may arise. How do you select? Well, first of all, you want to select a plan that covers all the drugs that you take. You want to consider the cost, and the cost can vary from plan to plan substantially. I have seen plans compared where there's an over $600 difference a year for the cost of prescriptions. So again, that's why it's important to actually look at your coverage each year, because the coverage changes every year. You also want to look at restrictions. Is prior authorization necessary before you obtain a medication? Are there quantity limits to your medications? And does the plan require you to have step therapy? And that is when a plan requires you to use a cheaper drug before you use a more expensive drug. If, however, you have already tried all these cheaper medications and they do not work for you, your doctor can do an appeal to the plan, and typically they will cover the higher cost medication. And then the other thing you want to look at is the pharmacy network. And here it's important that you actually use what's called a preferred pharmacy under the plan. So if you go to the drugstore and you ask your local pharmacist if they take your insurance, they're going to say yes, because most of the time they do take all the Part D plans. However, they may not be a preferred pharmacy. So what you need to know is, are you a preferred pharmacy? Because the cost of your medications will be lower if you use a preferred pharmacy. So again, a yearly analysis is needed. I know people don't like to do it. Actually, a recent survey showed that only 1 out of 5 beneficiaries does this. You could save money if you do it. You may like whatever insurance you have and you want to stay on it, but you should look at the cost of your medications every year. You can do that by going to the Medicare website. You can call Medicare, or you can call the Ohio Senior Health Insurance Information Program, short OSHIP. And they have trained counselors that will assist you. What you need to have ready is a list of your medications, the dosages, and the number of times per day that you take these medications. So as with Part A and Part B, there's also an extra help program for those who have Part D. In 2023, these are the income and resource limits. If a person is eligible for the full subsidy, or if a person is on Medicaid and they choose a plan that with a premium that is not higher than $34.71 a month, they will not pay a premium for the plan. However, if they choose a plan that has a premium higher than $34.71 a month, they will pay the difference. To sign up for this extra help program, you can go to the Social Security website, or you can call Direction Home, and we will go to that Social Security website with you and help you enroll. So now we're going to look to Medicare Advantage plans, sometimes known as Part C. So with Medicare Advantage plans, you can't just be enrolled in Part A. You have to have Part B. So you have to have both Part A and Part B. Most of these plans include drug coverage, but a few do not. So in your packet, you receive this very colorful chart of Medicare Advantage plans in your county. You will see that at the end of this chart, there are some plans, and you'll see a whole lot of red. Those are the plans that do not include drug coverage. If they don't include drug coverage, again, you have to get a standalone prescription drug coverage. So that would mean you'd have to get one of these, unless you have other creditable coverage through a retirement plan or the VA. You'll note that with Medicare Advantage plans, they all have out-of-pocket maximums. And that's a good thing for people who have or who face high medical costs each year. Those out-of-pocket maximums typically range from about $3,400 a year up to over $10,000 per year. Many of these plans have zero premiums. Most of them never required a 3-day hospital stay before receiving skilled care in a nursing home. So that was something that before you had to have with traditional Medicare before COVID. But with Medicare Advantage, that was never the case. However, there are provider limitations, or there can be. So on the chart, if you see the name of the plan and after it, it says HMO, that stands for Health Maintenance Organization. And typically under health maintenance organizations, you must use the plan's providers. That means there are doctors, there are hospitals, there are durable medical equipment providers, all have to be used in network. If it says HMO POS, that's Health Maintenance Organization Point of Service, and that's when your primary care physician can refer you to a provider that may be out of network. And then there's PPO, Preferred Provider Organization. Preferred provider organizations, typically you can go out of network. You may have to pay a little bit more for your visit, but you can use out of network providers. You will see that many of these plans have a 0 drug deductible, which is a change from previous years. Many of them have 0 copays for primary care physicians, but realize that if you use a lot of specialists, typically these plans will have copays of $35 to $45 a visit for specialists. And then again, if you have high medical costs or anticipate high medical costs for the year, take a look at those out-of-pocket maximums. One of the reasons many people like these plans, and right now, a little over 50% of people on Medicare have Medicare Advantage plans, and they like them because of these additional benefits. So you may have a gym membership, you can use telehealth. Some of these plans actually give you cash cards, like a credit card, with, I've heard, upwards of $600 a year that you can use to pay for whatever. So you need to take that into account when you're doing an analysis. Many include dental, vision, and hearing. Actually, most include dental, vision, and hearing at this point, although coverage may be somewhat limited. And next year, some of the plans are actually including transportation to and from doctor office visits. When I looked at changes in the Medicare Advantage plans from last year to this year, what I noticed was there are several 5-star plans in our region. So we're fortunate about that. 5 stars is the highest rating. And any plan that has 5 stars, you are able to join at any point during the year. So if you wanted to change your Medicare Advantage plan to a 5-star plan, you can do that. Premiums remained stable from this year to next. There were some decreases in out-of-pocket maximums. And as I mentioned, several plans added 0 copays for visits to primary care physicians. Included in Medicare Advantage plans are 2 Medicare savings plans. These are not very popular and they're not rated very highly. The company that sells them is called Lasso Healthcare. They're high deductible plans. They only cover costs after you reach the deductible. That what happens is the plan will deposit money into a bank account for you each year, and you can use that to pay for any of your healthcare costs. If you reach only Part A and Part B covered services count towards the deductible. If you reach that deductible, then you would be covered. Realize that you cannot be charged more than the Medicare approved amount. So just like with traditional Medicare, it would be, the charge would be the Medicare approved amount, not what the provider actually charges. And if there's money left in your account by the end of the year, so if you don't use that money to pay for services, it would transfer over to the following year. We also have what are called special needs plans. We don't include these on the chart. These are plans that are specific to certain individuals. So they may be specific to persons with chronic conditions such as diabetes or heart disease. They might be specific to persons living in nursing homes or to people who have both Medicare and Medicaid. Some do have premiums. Some also have medical and drug deductibles. The benefits vary and should be compared to other choices. If you're a person who has both Medicare and Medicaid and you are on MyCare Ohio, you should compare the benefits carefully to the benefits in your MyCare Ohio plans. Speaking of which, people who have MyCare Ohio, again, these are people who have both Medicare and Medicaid. They must choose either CareSource or United for their Medicaid plan. However, they can also choose to have either of these plans to be their Medicare plan, so they can combine their Medicare and Medicaid. This is called opting in. And if an individual opts in, so if they have CareSource for both Medicare and Medicaid, or if they have United for both Medicare and Medicaid, they will receive some extra benefits. So there are extra benefits included for opt-ins. But these individuals can choose to have their Medicare covered by either traditional Medicare or another Medicare Advantage plan. So since that is the case, people should be very careful to compare the services covered in each of these plans. So how do you select? Well, of course, you're going to consider cost, and you want to focus on the services you use most. So if you know you're going to have a hospital stay next year, you want to look at what the cost of your hospital stay is going to be. Compare traditional Medicare to the Medicare Advantage plan. Most Medicare Advantage plans will have certain daily rates for the first 5 days of staying in the hospital. Some of those rates would actually be more than your deductible under Part A. Also, you want to make sure that your prescriptions are covered and that the providers that you choose are in network. Look at the benefits carefully, especially for companies that sell a lot of plans, because there may only be subtle differences in these plans. So let's say you like Aetna, and I'm just throwing that out, not because I like Aetna, just for an example, but let's say you like Aetna. You want to look at each of the plans that they offer. And at that point, you may actually want to contact a broker that sells Aetna so that they can review with you those subtle differences. And of course, you always want to look at the star ratings. Again, I do not suggest that you select a plan lower than 3.0 stars. And you want to consider the plan's reputation. And that's not necessarily just what your neighbor says. So your neighbor may have plan XYZ and think it's great for them. That doesn't necessarily mean that that plan is going to be good for you. A good thing to do if you're considering changing plans is to call your doctor's office and ask them, number one, do they take the plan? Because things can change even before the first of the year. So you want to make sure your doctor takes the plan that you're considering, and you want to ask them, how easy is that plan to work with? Because those offices know which plans require a lot of prior authorizations and which plans deny services. So it's a good thing to call the office and ask about the plan's reputation. So again, you want to analyze the plans by going online. You can do that yourself. You can have a family member do it. You can call OSHIP or you can call Medicare, and they will assist you in comparing your coverage choices. So choose wisely. Remember, you can only switch plans during certain times of the year. This is open enrollment. If, however, you choose a Medicare Advantage plan and you decide that you want to change Medicare Advantage plans or change from Medicare Advantage to Original Medicare, you can do that between January 1st and March 31st. Now, if you're on traditional Medicare, you cannot change during this time period. So this special enrollment period is only for those in Medicare Advantage. Duals can switch. Duals, again, are those people who have both Medicare and Medicaid, and they can switch plans once per quarter for the first 3 quarters of the year. I'm now going to move to some new information that will affect Medicare beneficiaries, both beginning in 2023 and beyond. Just to let you know, each year the Medicare Trustees Report comes out, and it did come out already for 2022. The Hospital Insurance Trust Fund under Part A will be solvent until 2028. This was actually improved by 2 years, unfortunately, due to COVID deaths. This is also financed by employer and employee taxes. So we're okay for a few years with that hospital insurance Part A. Part B and D remain financed well indefinitely because they receive payments from the General Revenue Fund of 75% and monthly premiums charged to beneficiaries at 25%. In 2023, all recommended vaccines, such as the shingles vaccine, will be covered by Medicare in full. These vaccines are vaccines covered under Medicare Part D, D for drugs, so you need to go to the pharmacy to receive the vaccine. Also, there will be some limitations on drug prices for insulin, and those will be capped at $35 per month for a 30-day supply. Then in 2024, that 5% coinsurance I talked about, if you hit catastrophic coverage under Part D, that will be eliminated. Also, premium, so you won't be paying anything if you hit that catastrophic coverage. Also, the premiums will not be permitted to rise more than 6% per year. And the full subsidy for those eligible for extra help will be expanded. In 2025, there will finally be an out-of-pocket maximum for prescription drugs, and that will be $2,000 per year and will include your deductibles and copays. Then in 2026 to 2029, Medicare will finally begin to negotiate for drug prices, just like the VA does. They're going to start out with just a list of 10 medications because we know these pharmaceutical companies aren't crazy about this one. So we don't know what those first 10 medications are going to be yet, but we're expected to get a list by 2023. And these changes were all a result of the Inflation Reduction Act. There are currently some legal battles going on and some other advocacy efforts related to Medicare. For those of you that know about observation status, when you go into the hospital. So this is when you go into the hospital and you think you've been admitted, but you're really not admitted. You're on observation status. And by the way, they have to tell you you're on observation status within 24 months. I mean, within 24 hours. You don't want to be in the hospital for 24 months. So within 24 hours, they have to tell you about observation status. Now, sometimes a person is admitted, actually admitted, and then they get a surprise in the mail. So they get a bill in the mail that says, oh my gosh, your status was changed from being admitted to observation status. In the past, you were unable to appeal that change. You will now, next year, be able to appeal that change. Medicare is currently in the process of putting together those appeal steps. So more to come on that. The Center for Medicare Advocacy, which sued based on observation status and won, is actually suing Medicare now for violations of federal law protecting beneficiaries' rights to home health care. And this primarily affects people with chronic conditions who do have a right to receive home health care, yet home health care agencies are paid higher rates for individuals coming out of the hospital. So many individuals with chronic conditions are not receiving the home health care benefits that they have a right to receive. So there is a lawsuit concerning that. And then I'm sure some of you are aware that there is a movement by advocacy groups to have traditional Medicare include both dental and vision coverage. So again, more to come on that. And that's all I have for today. Are we taking questions now or waiting for Robert?
Sorry, it took me a second to get over to my unmute button. Let's go ahead. We only have, Robert, if you don't mind, we only have a couple of questions about your presentation, Francine. So the first is so you cannot get a Medigap plan if you choose a Medicare Advantage plan, is that correct?
Correct.
Okay. And the second question is the no balance billing by providers in traditional Medicare. Is the same true for Medicare Advantage plans?
No, because Medicare Advantage plans set their out-of-pocket costs themselves. So it's a little bit different.
Okay, well, that is all the questions that I have seen come through the chat. If anybody thinks of anything in the meantime, keep dropping them in the chat and we'll go ahead and turn it over to Robert Fenn from Social Security Administration. Thank you.
Right, come, letting the computer pull it up. You can see it, great. Voila. It's me, so hope you can see me. And I actually did have a question, Francine. I just wanted to make sure here, if I understood you correctly, in 2024, premium should not increase by more than 6%. So does that mean Medicare Part B would not increase by more than 6%? Just to make sure I'm clear on those details.
No, that was just for Part D.
Ah, just for Part D.
Yeah.
Yeah, because I know I'm going to hear a lot of news about it. If we get a cost of living increase, that means that my Medicare is going up, so I'm trying to have that. All right. Well, see, good people, I have questions too, and I work for the Social Security Administration. This is what we do. My name is Robert Fenn. I'm the Public Affairs Specialist for the Akron area, and I am very pleased and honored to be able to have this opportunity to speak to you on the behalf with Direction Home. And so I am going to give some updates with regards to Social Security. So again, thank you, Lori and Francine, for this opportunity. I am going to give you these updates for 2023, and then I'm going to add, kind of supplement, no pun intended, what Francine was mentioning in regards to how you enroll to Medicare. So that way you can see that Social Security is the avenue to Medicare. So let me quickly go over some changes that are going to take place in 2023. The first thing is the 8.7%. 8.7% will be the cost of living increase in 2023 to Social Security benefits. The individuals who are receiving SSI, supplemental security income, they will see that payment increase in their December 30th because the holiday falls on a Saturday. So therefore they get their check that Friday before. Individuals who are receiving Social Security retirement, Social Security disability, they will receive that increase in their January payment, 8.7%. Please be mindful that if you're someone who elected your benefits prior to your full retirement age, so let's say your full retirement age was 65 and 6 months or 66 and 8 months, and you took your Social Security checks at age 62, 63, we're adding the 8.7% to that amount as if you were your full retirement age. And then we do the deduction for the fact that you filed sooner than your full retirement age. Why am I saying that? Because many people will add the 8.7% to their direct deposit amount, and then they will get a letter from Social Security, because we're going to mail these letters out in December, throughout the month of December. And that letter is going to say, here's what your Social Security check will be through 2023. That dollar amount on that letter may be different than the amount that you did on your calculator, because you're starting with the wrong factor. You're starting with your net amount versus the gross that we use as Social Security. The maximum taxable earnings. I've received multiple questions as a public affairs specialist. There's some rumor out there or some thought that people think I am receiving a Social Security check, and because I'm receiving a Social Security check and I get a part-time job, that must mean they're not going to take any Social Security taxes out of my wages. Not so. Social Security is a pay-as-you-go system. So if you're working, they're going to continue to take Social Security taxes, 6.2% out of the wages up to $160,200. So if you're making $160,200 next year, they will continue to take those Social Security taxes at 6.2 from there. If you're making $160,200, put your name in the chat. I'd like to make you my new friend. Don't do that. The quarter of coverage, meaning what if I'm working and I have not earned enough throughout my work history, or I just started working? Maybe some of you have a grandchild or a child or whatever it may be, a loved one, friend, neighbor, and they said, I'm working and I'm trying to earn enough credits for Social Security. Well, next year, that dollar amount to earn a credit is $1,640. This year in 2022 is $1,510. So it's going up to $1,640 to earn a credit. So if you're perchance someone who's viewing this today and you said, I have 39, then you could receive another credit next year. I never know who's listening, because some individuals, if you have between that 30 to 39 amount of credits, your Medicare you still have to pay for it. But if you have the 40, then you won't have that Medicare Part A. Then you will have that Medicare Part A coverage without an additional premium. The average Social Security check is going to be for retirement, $1,827. For Social Security disability, $1,483. Excuse me. If someone was to pay the maximum taxable earnings every year, because Social Security uses the top 35 years over a person's lifetime. So last year was 147. Well, this year it's still 2022, $147,000. Prior years, even going back to the 70s, maybe around $6,000 to $7,000. So it increased each year. Well, if someone paid the maximum amount each year, what would their Social Security check be? It will be $3,627 in 2023. If you're working and you're wanting to know how much can I make without it affecting my Social Security payments in 2023, if you're less than your full retirement age, that dollar amount is $21,240. $21,240. That's from those who are underneath their full retirement age. If next year you are turning your full retirement age, you're turning 66 in 6 months or whatever it is for you, you're able to make $56,520 next year. So you can make that dollar amount from the beginning of the year up to the month right before you turn that 66 in 6 months. So whatever that 6 month was, January up to that month, you can make $56,520. Social Security has no concern. Once you hit your full retirement age, that month of hitting full retirement age, doesn't matter how much you make in terms of for Social Security benefits. Francine did an outstanding job of explaining Medicare in terms of the changes that could take place. And so it does start with Social Security as far as you filing. So I'm gonna quickly go over how do you contact Social Security, or how can you contact Social Security and enroll. It starts here. You see the Medicare, see the big red arrow on the right-hand side. If you go to our website, socialsecurity.gov, you can click on that link, that little tile, and then you'll see here on the screen here how to apply online. So you can do so right online. It takes an average of 10 to 15 minutes to submit the application. You click that button, you'll see there's bold, you see it's apply for Medicare only. There are some individuals who wish to start their Medicare benefits and not take their cash payments. This is the option for you. You can click that button in the middle of the screen here and it'll begin the process. What if you're someone who was working and you decided not to take your Medicare Part B? So therefore you're already enrolled meaning you just have Medicare Part A only. You can click on this link on that same screen and you will get these PDFs forms called a CMS 40B and the CMS L564. What are they? The CMS 40B just says, I want to submit an application to start my Medicare benefits. The CMS L564 says, I know I was eligible for it at 65, but I was on my spouse's insurance or I was on my own insurance covered by the employer group health plan and I was still working. So I decided not to take Medicare Part B. I didn't want to pay the $171.10 this year in 2022. So therefore, I elected to decline it. As Francine mentioned earlier, if you get enrolled to Medicare, they mail you the red, white, and blue card. And if you're still working, you could decline that Medicare Part B. You tell Social Security, I don't want that. I just want the Medicare Part A. So this would be your scenario because you're still working and covered by the employer group health plan. That the 564 will allow you to enroll to Medicare, and it allows us to verify you have the form filled out by your employer to state this is why the person did not take their Medicare Part B, because they were covered by a group health plan. Both of those forms can be mailed or dropped off or faxed to our local office. So you may want to ask, how do I get it if I want to fax it there? Don't worry, I got you covered. Right here on the right-hand side, you see where it says Office Locator. On this same screen, you can click on Office Locator. It'll pull up this screen and you can type in the zip code. Now you can do this any other time other than just Medicare, but if you wanted to reach Social Security office, you type in the zip code, and then the next screen, it'll pull up the Social Security office, which is closest to you based upon that zip code, give you their address, give you their phone number, and it'll give you the fax number, which you can use to fill out and send it in, faxing that document for your Medicare Part B insurance to be effective. Francine mentioned the extra help. You can have your Medicare Part D premiums possibly paid for, or the co-pays or the deductibles, if you meet those guidelines that Francine mentioned. But you can go to our website, or Direction Home can assist you, and they will go to this website, socialsecurity.gov/extra help. Please be aware we're in the holiday season. Thanksgiving is just a couple days right from us, and many people, we're all gathering and getting together, and so we tend to be a little more lax. You pick up the phone, hello, hey, you're happy, and then here you hear this phone call, your Social Security number's been suspended, something crazy like that. Well, that is not Social Security. That is not a means in which we would contact you by just calling you out the blue. More than likely, that is a scam. Please hang up. If you get any threatening calls from someone saying to you that your Social Security number has been suspended, which is something that we cannot even do, or they're trying to strongly threaten you or persuade you, coerce you to say, take this money from the bank account, from Social Security, your funds where you have your funds deposited, and now put it on gift cards or Bitcoin or anything like that, that is not Social Security. So again, more than likely, those calls are fraudulent. You can contact this source. Many people think that if they disclose their Social Security number, they think call Social Security, when the actual source that you should reach would be the FTC. Social Security, we maintain the Social Security records for retirement, disability, Medicare. We don't have any systems set up that says track Social Security numbers. Our information comes from IRS, right? Or credit agencies, Experian, TransUnion, Equifax, those sources. So you want to make sure that the FTC is aware of that, so that way they also send the notification out to those agencies and they can track. They want to know everything about that phone call, the sound of the individual's voice, what time did they call you, what did they ask for, how did they want the benefits to be sent to them, those things. You can also contact irs.gov, Identity Theft Central, or there's an 800 number you see on here, 800-908-4490. We have a do not call registry. You still can use that. When I say we as in the public, do not call.gov. Here's a number you want to take a quick little snapshot of. You can put yourself on that list. No one hates to more than I do, and sit down, have your dinner, Thanksgiving, and here's someone calling you, expecting to talk to you about whatever it is. Well, right now we don't have time for that. I'm about to have some turkey. Leave me alone. Right? You can call 888-382-1222. Put yourself onto that do not call list. And if you were to disclose information about your Social Security number and your benefits, and it's totally related to Social Security itself, not outside, like I said, the credit agencies, whatever. But if you gave them your Social Security information, as far as where your check is going, you can contact us with oig.ssa.gov. oig.ssa.gov. That is our FBI, and then they can help trace that information, not trace as far as terms of how, but keep track of what's going on. Unfortunately, elder abuse may take place. So if you're out visiting loved ones and friends and family, and you're not quite sure if things seem to be right, I'm going to share this phone number you see at the bottom, 800-677-1116, to report elder abuse. If you wish to contact Social Security directly, you can apply for benefits and call our phone number, which is 1-800-772-1213. That is our number, the national number to reach Social Security. Let me make sure I say this. You see on the screen here, 8 a.m. to 7 p.m., you can reach us. However, be mindful, since April 7th, we have increased the walk-in traffic to our office, but it's still limited due to the fact that we serve populations with high health vulnerabilities. So I encourage everyone to call first instead of just walking into the local office, because some offices may say, okay, we have a number of individuals here, that's our limit, and more than likely we're going to encourage you and give you an appointment. So I suggest that you call first, 1-800-772-1213. Maybe we can answer the question over the phone. Many of our services can be taken care of online, socialsecurity.gov, or at least we can make an appointment for you to come in. Now, with that being said, I'm going to give you this little tip that it's easier to reach Social Security when you call that 800 number, 772-1213, easier to reach us later in the day, later in the week, later in the month. Later in the day, after 10 a.m., later in the week, Wednesday, Thursday, Friday, later in the month, after the 16th or so. So that way, at least lessen the amount of time that you're waiting on the phone. My Social Security, I don't know how many of you have a My Social Security account, but I encourage you to check it out. We have over 70 million individuals who have already registered. You don't want to be left out, right? That's my persuasion. Yep, you want to make sure that you go to our website, socialsecurity.gov, and register for a My Social Security account so you can have access to your Social Security benefits, whether you needed that extra proof of your income, you're refinancing your home, you're getting a loan, or maybe that you just need to get your Medicare card, send that out to you, or maybe you need to change your direct deposit. You want to make sure that your money's going to the right place, right? Well, this is your option by registering for a My Social Security account. You have a series of things in which you could have at your fingertips now, including replacing your Social Security card. So you don't have to go to the Social Security office and wait in line that I mentioned, because you can do so online. So in front of you see all the things, or many of the things that you can do by having a My Social Security account. And in full disclosure, I do not receive Social Security benefits. However, I wanted to have another layer of protection on my Social Security record. So I opened up a My Social Security account just to make sure that I did it before someone else had tried. So it's a good option to have. That completes what I wanted to discuss. I'm going to close this out, stop sharing. And I, see that there's some questions there in the chat. I'm going to see if there are for us. Let's see here. For Francine. Let's see here. If they're hard, we're going to give them to Francine. Let's see. Let's see here. And let me get off the view.
The one I'm seeing is the Oprah's retiree.
All
Are
right.
you seeing that one, Robert?
Yes. Okay. As an Oprah's retiree, we are required to use via benefits to enroll in Medicare plans, but had received my card and it says Medicare A and B effective January. Via benefits says I have to enroll in Medicare Advantage plan through them. But if we do not use them, does that mean I am already enrolled in Part A? Yes, you're already enrolled. That came through us. So that meant that either you submitted an application or you were receiving Social Security cash payments prior to age 65. So then we enrolled you to the Medicare benefits. So regardless of what they're requesting, the action has already taken place. With that being said, I still would encourage you to speak to the Oprah's representatives just to make sure, so that we can have that's the coverage you're going to have to supplement your Medicare. You want to make sure that you've done all the actions that's needed. More than likely, though, you're still going to need to keep that A and that Part B.
Yeah, you need to be careful with OPERS. They have hired this company to review your retirement benefits. And typically your retirement benefits under OPERS or the Medicare Advantage plans that they're offering are different than the ones offering to the general public. And many times the coverage is better. So you do need to go through via benefits.
I see I'm disappearing on the screen here. I'm going to vanish and take care of this light somehow. There's another question here. Says that the person took early retirement, so they got their Medicare card automatically enrolled. What are the next steps to take care of the details? Sit back and relax. Yeah, you have done what you needed to do. You have the Medicare. Now, as you were a part of this presentation, Francine was giving the information in terms of Medicare Advantage plans and supplement plans. So this is where I would step back. And so this is where Direction Home could assist you, or you would contact OSHIP if you're looking to see what else can I have with my Medicare. But as far as your steps to enroll to Medicare, if you have that card, you're golden, you're good.
So typically this is the time when you need to decide if you want to have your coverage in Medicare through Medicare Advantage or through traditional Medicare. And if through traditional Medicare, whether you would want a supplemental policy. So you may want to compare those options, and to compare all of your options, I would suggest you call OSHIP.
Ohio Senior Health Insurance Information Program. Yes, yes. We keep ending with that strong P just to make sure. We don't want anybody sending emails to Lori. How rude.
Right. Over enunciate the OSHIP.
Yes.
All right. So any other questions from folks?
I have a question for Robert. I actually, this was a couple years ago and I gave up, Robert. I tried to do my Social Security account, and the questions they asked, I couldn't even answer. One of them was, was this your address ever? And I moved so many times when I was married, I couldn't recall. And one of them actually even had information about my husband's second wife, which I did not know the answers to. So now I don't know what to do.
You call the ex-wife and ask her. No, no, just play it. I'm just picking with her, Tim. Just picking with her. Now that we have a different system, when I say we, Social Security has, and that's the free plug up here, My Social Security. We have two external partners that now do the vetting of who you are to register for an account.
Okay.
If you open an account September 19th, 2021, or prior to that, then you're underneath the old way in which we were using a different system to verify that you mentioned, where did you live? Did you have a Ohio license? Whatever it is, all these variety of questions. Now we have login.gov and ID me. And so that would be the way that you would be, again, vetted. You answer their questions going through their website, and then it marries you with Social Security's website. And so then you go to Social Security, but you've already gotten your pass, your ticket to us by going to those sources. More than likely, you're not going to have to go through that again. I do encourage the public to, if you're having trouble and you go to My Social Security and it says this is not matching up, more than likely you can go to login.gov, cancel your password there, reset it, go through those normal procedures that we do, reset your password, then come back to Social Security and use that password and it'll bring it together. And even if you had trouble there, on our screen, you can contact us and you can cancel the Social Security because those records were together. Maybe you forgot your password with login.gov. You can come to us, cancel on our side. You can reset and bring it together. It sounds a little confusing, but what you're doing is bringing two parties together. And so more than likely, Francine, something was not coming together. You see how I put marriage in there because your analogy. So we could divorce and then we can marry again. So Francine, I found you somebody new.
Yeah, I couldn't verify my identity. So
yes, yeah. I can vet for you. Courtney and I will. We know who. Great question. Thank you for asking that.
All right. Well, I don't see any other questions that have come in, so you are free to run amok for the rest of your day. Everybody have a fabulous Thanksgiving. Thank you for joining us here this morning. We appreciate
Happy
you.
Thanksgiving, happy
Happy
holidays.
Thanksgiving. Thank you. Be safe.
Thank you
out
so
there.
much.
Thank you.
Yeah, thanks, Donna.
I like that name, Katie Bird. Take care, everybody. Enjoy yourself, Tim.